Probably the biggest issue with diabetes is that it's silent.
Pathological process is when your pancreas doesn't work, and it doesn't work properly. It doesn't secrete insulin either sufficiently, or your insulin starts not working properly.
The prevalence of diabetes in Australia is about 7.5% of the adult population.
So your blood sugars actually start rising. So basically it's a problem of uncontrolled blood sugars, and then the complications that follow that.
Eyes, feet, circulation, kidney function, sex life. It affects so many different areas.
So the overall increase in diabetes as a whole is huge.
Prevalence of diabetes, it's been steadily rising.
We need credentialed diabetes educators and dietitians that work in diabetes.
Diabetes is a very serious disease.
It's a very good question. What if we don't have any credentialed diabetes educators? I think I'm blessed to be working on credentialed diabetes educators.
I'm Christine Avery, a RN credentialed diabetes educator, and I've been a registered nurse for 33 years. I've been working in diabetes for 22 years, and I started my career pathway in diabetes at Frankston Hospital as a clinical nurse consultant in diabetes.
If we didn't have a credentialed diabetes educator, our life as a GP in managing these complicated patients would be much more difficult. It's just, I think, sometimes impossible to do, because we just don't have that time to be able to, and the expertise to be able to spend to educate the patients.
Being a RN credentialed diabetes educator maintains a high quality and standard. It allows registered nurses to become specialists in the field and grow and have expert knowledge in self-management and behaviour change, and help people live a more fulfilled life with diabetes.
Why I find it's special and good to work with Christine, my RN-CDE, is because she has an expertise in all areas of diabetes, as mentioned initially, both type 1, type 2 and gestational diabetes.
A day as an RN-CDE can be a very interesting day. I think that's what makes it so interesting. It's different every day. You have your clients booked in and you sort of think, okay, this is their second appointment. You have a little schedule yourself about what you feel you will do as your next education session, or it's their first appointment, so you're meeting them, trying to build up a rapport, and often your priorities are very different to what the client patient's priorities are.
Her knowledge is quite significant, particularly in the difficult cases, more relating to type 1 diabetes and those patients who are on insulin pumps. She manages patients to the current best evidence available and using the best form of technology.
I always answer their priorities first if they come in with questions, because I feel they won't listen to what you have to say until their needs are met. During the day you have phone calls where people ring up because they're very excited they're now pregnant, so that changes their management of their diabetes. So, they need a more urgent appointment, or someone will drop in because their meters or finger prickers broken, or their insulin pens aren't working, or there's, the day is always full of surprises.
I can't imagine as an endocrinologist not having an RN credential educator here. It is not possible to be able to manage it.
The major challenge that I find as a registered nurse diabetes educator is that diabetes is a silent disease, and you find it very hard to motivate people when they actually don't feel unwell. So it's trying to find what motivates people, and everyone have a different area of motivation. So it's tapping into how you can motivate each person as an individual to actually take an interest and a care in their self-management of their diabetes. If we had the magic on how to motivate people, and it would make the credentialed diabetes educators' job a lot easier.
Yes, hi, I'm Pauline. I'm 67 years old and I was diagnosed with type 2 diabetes 17 years ago.
Over the years, I've actually found my approach to diabetes education has changed, and I think that's just come with experience, and I think that's probably something that you can impart when you're mentoring, just to help people. That I've just found that it's really the patient education is really centred around the patients.
As an educator, we often have our set things that we want to kind of go through, but it's also tailoring it to their individual needs as well. So they can come in with 6 questions that they want to ask first, and they're not going to absorb anything else until those areas are kind of discussed and dealt with as well.
It was very daunting at first, and you have to adjust your lifestyle. There's a lot of things you have to adjust. Exercise, lifestyle, and Christine's very supportive and she's very encouraging.
It is all about helping the patients manage their diabetes and what is important to them.
My name's Kate Clark. I've had diabetes for 25 years. I'm 35 years old.
So it's all looking at them and them having a say in their management and their goals, and setting their goals and helping them achieve their goals.
Chris was there from the start when I was first diagnosed, so we've had a long relationship together. The support that she gives me, she goes above and beyond. Can't manage my life at all. You know, if I had to manage it on my own, I would probably be nowhere near as confident and being able to manage it as well. You know, in tough times as well, because it has been tough for me over the years with anxiety. It does cause a big strain on your diabetes. If I didn't have that help management and that team around me, nowhere near as happy and confident as I am now. Absolutely.
The job is very busy and very changing and can be very challenging, but I think I'm a great believer in health promotion and helping people fulfil their dreams and their life, particularly the kids with type 1. So I think that's probably the rewarding part of the job.